Okay, welcome everyone. We are Skype, also known as Student Interprofessional Education Organization at Sac State. And this is the introduction to IPE, or Interprofessional Education. All right, we're so glad that you can make it. Today we're going to share a few things about what IPE is and its importance in the healthcare field. And before we get things started, we would like to go over today's agenda and what we'll be doing for the next 50 or so minutes. Okay, so we're going to start with officer introductions, and then what is IPE and why it is important, why join SIPE, the 4 core competencies of IPE, icebreaker questions, or get to know your interprofessional teammates, what professional contribution to IPE, what professionals contribute to IPE teamwork, case study, breakout room, and then membership guidelines. And then we also have social media outreach and a save the date page for you all. All right. So just for introductions, hello everyone, I'm Marie. I'm the president of SIPE for the 2021-2022 school year. It's so nice to meet you all. I'm so glad you all could attend. All right, whoever wants to go next.
Hello everybody, I'm Janet Mesa. I'm the treasurer and PR. Nice to meet everybody.
Hi everyone, my name is Kendra Campbell and I am the CSAD liaison this year for SIPE.
Hi everyone, I'm Melissa Woznicki and I'm the nursing liaison for SIPE.
Hey everyone, I'm Rebecca with the social work as a social work liaison.
Okay. And our secretary position is currently open. So juniors or seniors who are interested in applying, please email me. Our contact information will be towards the end. But yeah, I can walk you down like all the requirements for the position and everything. It's a super easy job. So if you're interested, just let me know. All right. Okay, so and our faculty advisors, I'm not sure if they're here with us today right now, but I just wanted to introduce you to them. Dr. Hagee is one of our faculty advisors, and Dr. Nuruddin is our other faculty advisor, and they're in speech language pathology and nursing. Right. Okay, so this little activity thing, or just I'm hoping you guys could put your discipline in your name. We put, oopsies. We put a little how to do instructions in that picture right here. I'm gonna do it myself as well. So just add your abbreviation of your major or path, your major or discipline. Okay, great. So okay, if you're a CSAD major, you can put CSAD or SLP. If you're nursing major, nursing, OT, physical therapy, yeah. I think it's pretty explanatory now. And then, okay, I'm going to create a poll or put in a poll. I'm not sure. Okay. The polls are not working for me, so I guess it's all right. We can skip that one. Okay. All right, so we can start now with our presentation. What is IPE, or Interprofessional Education? Interprofessional education occurs when students from 2 or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. Why is IPE important?
IPE is important because it is not about education for education's sake. It's about improving health, creating support systems, and trying different models of practice. It intentionally supports people, including health professionals, health workers, students like ourselves, residents, patients, families, communities, so that together every day to enhance collaboration and improve health outcomes while reducing costs.
And these are the organizations, many organizations that support IPE, and they're located all around, I'm guessing North America for sure. All right. Okay, why join SIPE? or student interprofessional education. You can join SIPE to gain interprofessional skills, to collaborate with peers from different healthcare professions, to learn about patient-centered care, to build your CV and resume, and find leadership opportunities. Okay, now the 4 core competencies of IPE.
Interprofessional communication. We use respectful language appropriate for a given difficult situation, crucial conversation, or conflict. Recognize how one's uniqueness contributes to effective communication, conflict resolution, and positive interprofessional working relationships. Listen actively and encourage ideas and opinions of other team members.
Values and ethics. Values and ethics are to embrace the cultural diversity and the individual differences that characterize patients, populations, and the health team. Respect the unique cultures, values, roles, and responsibilities and expertise of other health professions and the impact that these factors can have on health outcomes. We also develop a trusted relationship with patients, families, and other team members.
So we have roles and responsibilities within our interprofessional relationships, and we want you to forge interdependent relationships with other professions within and outside of the health system so that we can improve care and advance learning. And we want you to engage in continuous professional and interprofessional development to enhance team performance and collaboration. And also we hope to help you recognize your limitations and skills, knowledge, and abilities when you're working on a team.
Teams and teamwork are really important in SIPE also. You gotta engage self and others to constructively manage disagreements about values, roles, goals, and actions that arise among health and other professionals and with patients, families, and community members. We share accountability with other professions, patients, and communities for outcomes relevant to prevention and healthcare, and use available evidence to inform effective teamwork and team-based practices.
All right, why leadership is important. SIPE thinks leadership is important because it's important to be both a leader and a follower when necessary. Sometimes you need to take the lead and sometimes you need to listen and follow. Following is important. Important distinction, following doesn't mean you don't speak up when you know something needs to be addressed. We need to have both leaders and followers to have an effective team. All right, so, okay, we have a little interactive activity. We're hoping that we could break the ice, also known as icebreakers. Just your name, your major discipline, and you can either choose to talk about the highlight of your week, or you can name one profession you believe is involved in the interprofessional collaborative practice. So I think we already know, like there's SLP, there's nursing, social work. So those who go first, you can easily take those easy options, but okay. So whoever would like to share first.
I'll go. Hi, my name's Liz. My major is CSAD. I'm in the second bachelor's program. And I know you just said SLP, and so I'm gonna skip that one and say OT and surgery or orthopedics.
I can go next. My name's Omri and I'm a nursing major, and the highlight of my week will be on Friday when I start my preceptorship.
I'll go next. My name is Joy. I'm a graduate student in the CSAD program. The highlight of my week will probably be on Friday when hopefully I have turned everything in for the week.
I'll go. I'm Colleen. I'm a junior in CSAD. And I think the highlight of my week was getting a job at the Children's Center. That'll start next week.
I can go. My name's Lorraine, or Lola. I'm a senior in our CSAD program at Sac State, and the highlight of my week was honestly probably the pizza that I had before this meeting, but I mean, that can change throughout the week, but so far that's probably the highlight.
I'll go next. Hi, my name is Alana, and I'm also a junior in the CSAD program. And the highlight of my week will probably be when I finish my lab, probably this Thursday, which is building a structure of the larynx and out of Play-Doh. So I'm kind of excited for that, and I feel like it'll definitely be a highlight when I finish.
I can go next. My name is Stephanie. I'm a CSAD major. The highlight of my week was taking a 15-minute nap for the first time in I don't know how long.
My name's Hannah. I'm in the nursing program at Sac State. And I'll talk about another profession in the IPE collaborative practice, and that would be physical therapy. My brother's a physical therapist, and I work with a lot of physical therapy in the hospital. So definitely know that there's a lot of interprofessional communication with them.
I can go next. I'm Kieran. I'm a CSAD senior, and the highlight of my week was I work with disability patients, and we did yoga today, and I felt like it was just very calming. So.
I can go next. My name's Erica. I'm a senior in the CSAD program. And the highlight of my week was finishing Love on the Spectrum, the second season.
In the chat, Alyssa said, "Hi, my name is Alyssa, CSAD senior. The highlight of my week was going to the beach and procrastinating on my quiz." Love that.
All right, anybody else would like to share? You could also put in the chat. I'm realizing that's a good idea if there are anybody who can't unmute right now. Please feel free. Oh, Rebecca raised her hand.
I would like to share. I've been working with a client for 3 weeks, and she is nonverbal, and she doesn't mand. But today she had an excellent day, and she was actually clapping her hands and and manding by clapping her hands. So it was a really huge thing or accomplishment, and everybody was super pleased. So I'm really happy about that.
Thank you for sharing that, Rebecca. That sounds like a really cool highlight of the week.
Yeah,
that's wonderful. All right. Is there anybody else who should in the chat? Okay. Anybody else want to go? All right. No worries. Okay. Hannah in the comments, she said, "Hi, I'm Hannah. I'm a Seaside junior. My highlight of the week is that I went home and saw my cats." I love that. Cats can be so comforting. Okay. All right. If there's nobody else who likes to go, we can go to the next slide. Awesome. Okay. So the reason why we wanted to share about ourselves, just so, you know, make the environment more comfortable, because it's like, you know, when you're working in a team, you gotta, like, you know, be comfortable around the people that you're working with. And we also wanted to mention or know if any of you know any other professionals involved in the interprofessional collaborative experience besides SLPs, nurses, occupational therapists, physical therapists. Yeah, there's some good ones that we heard. So, okay. What professions typically contribute to IPE teamwork, and what do they do?
Okay, what does an SLP do? Speech language pathology encompasses the professional practice of communication and swallowing disorders. SLPs assess, treat, and diagnose speech and language disorders. SLPs work with individuals with hearing and balance disorders. Populations, we work with people all across the lifespan. Degrees you can obtain, you can earn a BS in CSAD, and then you can work your way to an MS and become an SLP. Certifications you can obtain, you can get your CCCs, which are your Certificate of Clinical Competence, and you take CEUs, your continuing education units, to maintain that CCC. Branches that you can go into, you can work at a school, you can work at a medical setting like a hospital or a private practice. We work with clients with brain injuries. We can do early intervention, dysphagia, like swallowing disorders. We can work in the NICU, and we can work with people with autism. And then for IPE and the SLP, SLPs interact with other professionals frequently. We get critical information from other specialists to learn about the client's history and background before conducting assessments and reaching a diagnosis.
So what does social work do? Types of populations you can work with: anyone who needs our help or assistance, children and families, domestic cases involving violence and abuse, child protective services, and degrees you can obtain for social work is a BWS, MSW, LC, SW, and an MFT. Certifications you can also obtain are license in arts therapy and a license into clinical practice. Branches that you can go into is almost anything. Social work is very diverse, and it's actually very critical and needed. So including, but not limited to, schools, hospitals, community service, mental health services, and many more.
So this is the definition of nursing from the American Nursing Association. It says that we protect, we promote, and optimize health and abilities, and we facilitate healing and alleviate suffering. Like day-to-day, nurses will give meds, they'll provide help with activities of daily living, and they basically do like a majority of the hands-on care for their patients. One of the more important things that nurses do, though, is assessment. So what makes nurses valuable compared to just not that caregivers aren't valuable, but what makes a nurse a little different is that they assess what's going on with the patient, and they provide everybody like the most up-to-date information on how the patient's doing, and your nurse will know the most about how your patient's doing every day. And then in addition to performing assessments, they advocate for their patients. So they figure out what their patients need, and then they will go to the other interprofessional members of the team and ask for what their patients need. They'll ask for orders from the doctor, or they'll see if they can get a physical therapy consult or a speech language pathology consult. So that's what nurses do. And these are some other involved professionals: recreational therapists, audiologists, occupational therapists, dietitians, physical therapists, psychologists, psychiatrists, neurologists, pharmacists. The list goes on. And we're going to talk about a couple more.
All right, so what does physical therapy do? If you're interested in physical therapy, specialties, physical therapy is a specialty field that evaluates, assesses, and treats individuals with functional mobility limitations. You would help improve a person's bodily movement, mobility, and function. Top types of population you can work with: all individuals with injuries, individuals with disabilities, hospitals, outpatient clinics, people's homes, schools, sports and fitness facilities, workplaces, and nursing homes. Now, what does occupational therapy do? Increase the individual's ability to safely and effectively perform everyday tasks, help the person gain independence, And the types of populations you can work with are people of all ages who have physical, sensory, or cognitive problems. Branches and specialties you can go into. There are many branches, 30 plus branches. It includes driving, autism, brain injury, industrial support, low vision, and aging.
So physicians and physician assistants, they place orders for everything, and they do assessment as well. But as far as their role in the interprofessional team, they kind of like manage a patient's care by putting orders in for everybody else to do everything. So they can order prescriptions, they can order consults, they can order surgeries and procedures for their patients.
What does pharmacy do? So pharmacists distribute the disbursement of prescription medicine. They advise patients on how to correctly administer medicine as far as dosage, possible side effects, and interactions with other drugs. Types of populations that you can work with is anyone who takes medication, including all of our clients.
What does nutrition do? Pediatric nutritionists work frequently with individuals who have feeding and swallowing disorders and nutritional deficiencies. They are involved on a team involving an SLP, a pediatrician, feeding and swallowing specialist as well. Populations include individuals with developmental delays, neurological impairments, autism, Down syndrome, cleft palate, premature infants, and eating disorders.
All right, so that brings us to our overall goal and the overall goal of IPE. So what is the overall purpose, vision, and goal for all of these fields? It's to improve the individual's quality of life. All right, so, okay, we're going to go into breakout rooms for like 3 to 5 minutes. We're hoping to like collaborate and, you know, put that teamwork into work. We have a few discussion questions, or like it's a case study. Here we are. That we're hoping we can discuss. We're gonna put it in the chat for everyone, so everybody still has it. Okay. Who was the one that has the? Do we have the groups ready? Let me see if okay.
I'm almost done. I'm just making sure that we have people in each one that can lead them.
Thank you, Melissa. While Melissa's doing that, I can go over the questions. I'll read them over. So, okay, for the first question, JR is a 6-year-old male who arrives at the hospital after a car accident with a traumatic brain injury. So at this point, who interacts with him at this stage of care? So for the second one, JR is ready to be discharged with some persisting symptoms like memory, motor problems, and fatigue. What professions will be involved with his rehabilitation team? And remember, that would be like the IPE team. And what barriers are preventing him from returning to work? All right. So I'll be sure to copy and paste these discussion questions. And the facilitators in there will be there to help guide you guys and facilitate the discussion. So don't worry if you don't know, or if you feel there might be an awkward silence, don't worry. We got you covered. Right.
Hello, everybody. You're welcome to keep your cameras off or turn them on, or only use audio or use the chat, whatever you guys are comfortable with.
I'll use my audio. I'm just cooking, so I don't want to show my face right now.
Cool. Okay, so let's see. I will work on putting the questions in the chat really quickly, but meanwhile, I'll read it out loud so you guys can settle it in for a while. So the questions are, JR is a 60-year-old male who arrives at the hospital after a car accident with a traumatic brain injury. First question is, who interacts with him at this stage of care?
So nurses, of course, and whoever the providers are there. I'm not sure if there's probably I would say maybe respiratory therapy even might be in there, but I don't know. That's that for sure.
Okay. Good answer. I can also ask, who would see JR first after he made the 911 call?
Paramedics.
Yeah. Any other possible options you guys want to add? Cool. Okay. So second part. JR is ready to be discharged with some persisting symptoms: memory, motor problems, and fatigue. What professions will be involved with his rehabilitation team?
I agree, physical therapists. I think SLPs too. There's something that we can we can answer. Rehabilitation centers. So yeah, I think there could be a number of people helping, right?
Yeah, definitely a good set of people in that team.
I would add occupational therapy as well for the motor, which I would think would probably be ADLs and whatnot.
Yeah. Okay. What barriers are preventing him from returning to work? And again, his symptoms are memory, motor problems, and fatigue.
I would consider all of them being barriers.
Who is going to help him advocate for changes in his work environment?
Social worker.
Social worker. Yep. Who would you guys say could possibly refer or write up some type of proof that he is physically hurt?
His primary physician.
Any other? Okay. He is having trouble eating. Who would he see for assistance? Another option. When we think of dietary needs or food related things.
Nutritionist.
Yeah, exactly. Yeah. Okay.
What if they're having trouble swallowing though?
SLP.
Yeah. Who would help him if he was having trouble managing his emotions?
Go ahead.
Oh, it's okay. Go ahead. You can go.
I'm not sure, but psychiatrist? Or is it more
Really interesting. There's some in here that I wouldn't even think of. So like social work and a therapist, and surprisingly an occupational therapist or a speech language pathologist.
Huh.
Yeah.
Good to know.
Yeah, good to know, especially if you're the one asking for consults, right?
Yeah.
Realistically, everybody gets some type of training of emotions, right? How to deal with it.
That's true. I guess that's where the therapeutic communication for nursing students comes in.
Yeah, definitely involves a lot of empathy. Yeah. Okay. And who would help him build up strength to lift boxes at work?
PT, OT.
Perfect. Exactly. Yeah, we got through all the questions.
I have a question about one of the questions. Is that okay?
Yeah, of course.
So I think one of them was, you said that who would he need a referral from? And we said physician. Are other areas like nurses, for example, are you guys able to write something for him in terms of work, or does it specifically have to come from someone else?
So physicians have to place the orders. You have to, or like a nurse practitioner could potentially place orders, but you have to be like a provider who can place orders for things. So usually that's only a physician assistant, and then nurse practitioners. Nurses can request orders. They do left and right, but it has to be like signed off by a provider.
Oh, I thought these questions would take a lot more time because it's a lot of questions.
Well, it's been more than 3 to 5 minutes. I'm gonna hop in another couple breakout rooms and just make sure everyone's wrapped up, and then we might wrap things up.
Okay.
Because there's another something.
Oh, okay. Thank you, Melissa. Do you guys have any other questions or comments? Or maybe you can say in your own field, what do you think would be your most important role in this situation to make sure he gets the best care? We can talk about patient care a little bit. So just a little reminder, he is a 60-year-old male who arrived to the hospital after a car accident with a traumatic brain injury, a TBI.
Well, an SLP would help with the cognition piece of helping him rehabilitate his memory, working memory, executive functions, depending on where his damage, his TBI is at too. We got to think about language. Was that affected? Coming into the field, I had no clue how much cognitive functioning we were responsible for.
Oh,
so, yeah.
Yeah, me too. Definitely agree with you. And swallowing. I don't know. I never really thought about that.
Same.
Yeah.
It's like those memes that you see, like, oh, we were just going to play with kids on the floor all day.
Yes, exactly. That's exactly. Oh my gosh. What about nursing? I mean, there's it's closing in less than a minute. Well, okay.
Thanks, guys. I'll see you in there.
Thank you guys so much. Great answer.
Good seeing you, Janet.
Bye, Stephanie.
Bye.
I'm thinking we should, let me present real quick. Should we confer on what we've talked about, like discuss our findings, or?
Yeah, or if anybody has anything they heard that was like really interesting.
Good one. That's good. Okay, so does anybody want to, do we have everybody? I think we do. Okay, does anyone want to answer the first question, what their group talked about? Who interacts with him at this stage of care? So immediately after the car accident and the TBI.
Would be the EMT team and the EMRs.
Yes.
And I had to kind of step back and think about it because I was like, oh, the nurses. And Kendra was like, no, right when it happens. And
right.
You don't realize the care starts at that moment. I don't know. I thought that was interesting.
There might be a nurse on the ambulance, and there's also paramedics. But yeah.
Great point, Lola. Yeah, care immediately starts like right from the injury. So yeah, that's a good point. Okay, so then JR is ready to be discharged with persisting symptoms, including memory, motor problems, and fatigue. So anybody know, or anybody able to contribute what they talked about for question A? What professions will be involved with his rehabilitation team?
We were talking about occupational therapists and physical therapists as part of the team.
Yeah, there are big ones for helping with like self-help and adaptive health. Yeah, and knowing how to do everyday tasks. So yeah, that was a big one.
I also would say social work.
Yeah. Could you elaborate, Rebecca, on where?
Yeah, the social work will be like providing resources, like financial help if needed, or just guiding JR to the right people that he needs for even emotional support after. And I was talking in my group how like most cases of post-traumatic stress syndrome come from people that have experienced war or car accidents. So those tend to be pretty significant in those types of critical incidences. So definitely would a social work would lead him for continued care, for either psychotherapy or whatever he needed to continue on and lead him to the right avenues.
Thank you for your answer, Rebecca. That's well said. Okay, anybody else know what other professionals might be involved?
I like that Liz also added neurology. She said SLP, OT, and neurology. That wasn't on our list.
Yes, like the neurologist specialist would be big on like neurological disorders or neurological injuries. Yes, that's a big one. Okay, and then what barriers are preventing him from returning to work? What do we think? What type of barriers? I can give a hint. They're like cognitive barriers that we talked about in our group. Memory and attention might be affected for sure. And you know, you got to memorize, like for example, in SLPs, got to memorize which clients they're going to be interacting with on a day-to-day basis, and attention. You got to make sure your attention is alert and on during work. Any other type of barriers that anyone can think of?
Mike brought up maybe the acceptance from actually his job, or let's see what's up with it.
That's a big one. We talked about that in our group too, that like social barriers might be like, sometimes a brain injury can affect someone's pragmatic or social skills, or it could also just be difficult to socialize with those skills impacted. So for sure. And then Lola said accessibility provided through his job might not be what he needs. That's another one. Sometimes accessibility is just not as what's the right word? It could be, it might not be helpful to what he needs, it's not like every day that you have a TBI and you have to go back to work. So accessibility needs could be a barrier. Okay, great answers, everyone. So now we're going to go over membership guidelines. Since we have 6 minutes, we'll try to hopefully we can get you out of here at 7:50. Okay, so connect with us, how to become a member, our social media, and Hornet Hub. So these are membership guidelines of SIPE. You must attend 3 events per the school year. So SIPE holds 3 events per semester. So there's usually, it's easy to just think of it this way. We have a September event, October event, November event, a February, March, and April event. So just 3 events per the school year, not the semester. We are in the process of creating an attendance form for SIPE. So look out for a link in the chat and in the email blast. So it'll let us know who attended the events. I think we might have the link now. If anybody, if I think Janet, if you're able to put it in the chat for us, thank you. And then sign up using Google Form and Hornet Hub. This will be in the next slide. All right. So the Google Form is just for us to know. For the email list, we would like if you could like attach your email to the Google Form scan over here. So you're connected to our email list, so you know when we're going to be holding events, hosting events. And then on the right is how to actually sign up for SIPE through the university system. Because if you want it on your record that you are a member of SIPE, you should definitely go to Hornet Hub and search Student Interprofessional Education, which is, yeah, I think it's when you go up to the top at organizations, you just search Student Interprofessional, it'll show up, just click join, it'll show the login information right here, and then you put that in and then you're officially a member. Awesome. And Janet has put the attendance Google form in the link if you could sign that. And that is separate from the membership application right here. All right. Okay.
Yeah. And then like Marie just said, you can find us on our website. You can find us on Instagram at SIPE and you can find us on Facebook. And you can save the dates as of now. October is our next meeting, October 26th, also at 7 p.m. The Zoop League will come. And in November, we also have our date, November 30th, also at 7 p.m. The October one is another case study. You kind of got a glimpse of that today in our breakout rooms. November meeting is head trauma panel or TBAs to be announced. Yeah.
I do want to add the head trauma panel is not set in stone yet. We're still trying to, we really want to do this event because it would be a really interesting and interactive event. So we're hoping, but we just wanted to put it there for you all to look forward to. All right. And then just to let everyone know, those who are in NISLA, SIPE events counts for NISLA points. So this is the form here. If you want to take a screenshot, and you can put in that you attended our SIPE events today. Yes, and Kendra has also put it in the chat for those who can't scan the QR code. All right.
Melissa?
Yeah, so if you're a nursing student and you need N145 credit, can you guys just bring your IPE forms to class on Wednesday and I can sign it? I'll try to come early or I can sign it right when class ends. But Brady wants individual signatures on each one. I can't just send a list of names over to her.
Thank you, Melissa. All right. Okay, so thank you, everyone. I think that was, yeah. Thank you, everyone, so much for attending our meeting. I think we made it, yeah, we made it 2 minutes before 7:50. Awesome. Anything else that any of the officers wanted to add?
Oh, there's a question in the chat. Yes, Amory, next Wednesday, not this Wednesday, because this Wednesday we don't have class. Thank you.
Thank you.
Does anybody need me to go back to a slide just for, I know we threw out a lot of like QR codes and information right here. Just let me know. We can also attach the slideshow to the emails that we'll be sending out. Awesome. Okay, thank you everyone so much for coming. Oh, sorry, did I cut someone off?
Sorry, really quickly, this has been recorded, so if you guys want to let people know that they missed it, they can still watch it. It'll be up on one of our SIPE YouTube accounts. I'll post that on our Instagram.
Thank you, Janet. All right. Okay, everyone have a great night. Thank you so much for coming. Please look out for our next event coming on the last week of October on a Tuesday. All right, have a good night, everyone.